I'd like to talk to you today about anxiety, specifically recognising anxiety in the body. I always talk with clients about the physical body and how anxiety shows, because it can quite often be hidden as something else. So often we can have different kinds of physical symptoms and experiences and not realise that it is actually anxiety. Now, when I say anxiety, I mean a symptom because of stress hormones flooding through our body. I'm going to do another video on actually what causes anxiety, the background, but this is just about what does anxiety feel like. Interestingly, a lot of people don't get all of these symptoms in one go. They might just get one in a subtle way, in the background way. That's why I always check for whether it is anxiety. It's about knowing your anxiety signature, your particular one. So one of the first things that gets really impacted by anxiety is the gut. Now, this is because the digestive system is not needed if our body thinks we are in danger. So blood goes from the digestion and from the mouth into the major muscle groups. So this means we get things like a dry mouth because we're not getting enough saliva. The body doesn't think it's helpful at this time. We're also not digesting well. We're not getting enough blood flow in our gut, and our food can feel undigested. It can be heavy in our stomach and we can get stomach pain. And the reason that's an indicator for anxiety is to say your body's in the fight or flight. It's in a stress response, so it's not digesting food properly. And this is one of the reasons that sometimes people can say that IBS can be made worse with stress. Similarly, if we get butterflies in our stomach, I think we're all quite familiar with that. That can be an indicator that we're in a stress state, that we have stress hormones in our body, because it means we're not getting enough blood flow and thus enough oxygen into our gut. Interestingly, bladder urgency, feeling the need to go to the toilet, that can be a symptom of anxiety. I think we've probably all had it when maybe we've got an interview or something important and we have to keep going to the loo. But our muscles can relax in our bladder in response to extreme stress, or even just chronic stress. It can make bladder problems a lot worse because the nerves are agitated by the stress hormones. Palms can become sweaty. Our body's trying to keep us cool in danger, so it might just be that you have chronically sweaty palms. That could be your indicator that you are actually feeling anxiety. Heart's beating faster, that's really quite an obvious one. Sometimes that can be mistaken for a heart attack as well. A panic attacks, they can look very similar to heart attacks. This is why it's really tricky, and physical symptoms should always be checked out with your GP. However, if you've been given the all clear and they say, well, it's anxiety, then this is what's happening in the background. The stress hormones are creating this symptom. One of the big ones is changes in breathing. So when we go into an anxiety state, our body makes us quite unconsciously breathe a bit more shallow and a bit quicker because it thinks we're about to fight or flight. This can create a sense of dizziness. And of course, if we then feel dizzy and then we worry about it, we feel in danger, which can release more stress hormones. But we'll talk about dizziness at another time. Yeah, the fancy word is hyperventilation, but this shallow, not quite breathing correctly can be chronic. And sometimes people can say, I just feel anxious and I don't know why. And it might be that they're not actually worried about anything, but their body, their physical body is not breathing properly, and that's creating a sense of anxiety for them. So another one is changes in vision. I've had this myself when everything goes blurred and you get this kind of tunnel vision. It can be quite frightening. That's just an indicator that your body's responding to the stress hormones that are in you. So as I said before, we might not get all of these. We don't have to have these really intense symptoms all in one go. When that happens, we do tend to call it more of a panic attack. But so many of us have low level chronic anxiety. Oh, just a stiff neck every day, or we're not digesting our food properly. And if medical reasons have been ruled out, that could be that your body is in the fight or flight and you are struggling with what we call chronic anxiety. I'm going to be doing some more videos looking at how to recognise anxiety in our thinking, how to recognise anxiety in our behaviours, and how to understand it in our emotions. So if you'd like to know more, please subscribe. My name's Dr. Abigail and I'm the Clinical Director of Malvern Hills Private Practice. Thank you.